Scalp is a soft tissue which covers the scalp is scalp like better. So scalp is a soft tissue which covers the calvary of the skull. Okay, and the it extends from the supraorbital margin to the external occipital protuberance. We have external occipital protuberance here. We can palpate the external occipital protuberance. It extends from the supraorbital margin to the external occipital protuberance, and on either side of the external occipital protuberance we have nuchal lines are there. These are nothing but superior nuchal lines. So it extends from the supraorbital margin and to the external occipital protuberance. On either sides, it extends up to the zygomatic arch and it enters into the temporal region superficial to the temporal fossa. So the scalp, it extends from the supraorbital margin to the external occipital protuberance behind. On either side it is extended to the zygomatic arch superficial to the temporal fascia. So coming to the layers of the scalp, SCALP, scalp. Coming to the 5 layers, S stands for skin, and C stands for close network of fibrofatty tissue, A stands for aponeurosis, L stands for loose subaponeurotic tissue, and P stands for pericranium. So these are the 5 layers of the scalp. S for skin and C for close network of fibrofatty tissue, and A aponeurosis or Galea aponeurotica, L loose subaponeurotic tissue, and P stands for pericranium. And the first 3 layers, they move as a whole. The first layer means skin, close network of fibrofatty tissue, and aponeurosis, they move as a whole. And coming to each description. So the skin consists of rich hair follicles. The skin consists of, it is very thick first of all, and it consists of hair follicles, sweat glands, and sebaceous glands. So, and the skin, it is because of the presence of sebaceous gland, the sebaceous cysts are usually formed in the skin area, in the skin, first layer of the scalp. And coming to the second layer, that is close network of fibrofatty tissue. This close network of fibrofatty tissue, here this layer consists of thick, dense amount of fibrofatty tissue, and also blood vessels and nerves are also there in this second layer, that which connects the skin to the underlying aponeurosis. And the blood vessels here, the walls of the blood vessels, they are firmly attached to the fibrofatty tissue. So if any torn or any cut happens in the blood vessels, they are unable to retract because the walls of the blood vessels, they are attached to the fibrofatty tissue, so they are unable to retract. So any small injury in the scalp, that means any small injury to the scalp causes profuse bleeding because they are layers, the walls of the blood vessels, they are unable to retract because of the attachment to the fibrofatty tissue. And inflammation of the this layer, inflammation of the dense fibrous tissue, inflammation of the dense fibrous tissue also causes much pain because of the unyielding reticulum. So the first is skin layer, skin, and the skin consists of numerous sweat glands and sebaceous glands, and it's a region for the formation of sebaceous cysts, and also hair follicles are also there. And the second layer is the close network of fibrofatty tissue, and this fibrofatty tissue, it is very dense and it consists of blood vessels and nerves, and the walls of the blood vessels, they are attached to the fibrofatty tissue. So if any cut happens in the fibrofatty tissue, the walls does not retract, so profuse bleeding occurs, and inflammation also causes much pain because of the unyielding reticulum. That's about the second layer. And coming to the third layer, that is aponeurosis. It is also called Galea aponeurotica. Here in the aponeurosis, along with the aponeurosis, we have 2 pairs of muscles are there, frontal muscle and occipital muscle, and the frontal muscle arises by 2 bellies, and the occipital muscle also arises by 2 bellies, a pair of bellies. And coming to the occipital muscle, the occipitalis, it is arises from the lateral 1/3 of the superior nuchal line, and also from the mastoid process. We can palpate the mastoid process behind our ear, and so the occipital belly, which is present in the third layer of scalp. The occipitalis muscle, which is present in the third layer of scalp, it arises from the lateral. So superior nuchal lines are there on either side. Lateral 1/3 of the superior nuchal line, and here is the mastoid process. That is the origin of the occipital bellies. And coming to the frontal bellies, they don't have any bony origin. They arise from the skin and subcutaneous tissue over here on the forehead. So the frontal bellies have no origin, and the occipital bellies, they arise from the lateral 1/3 of the superior nuchal lines and also from the mastoid process. So these frontal bellies and occipital bellies here, they are attached by Galea aponeurotica or nothing but aponeurosis. So the occipital bellies and frontal bellies, they are attached to each other by Galea aponeurotica, which is nothing but the third layer of the scalp. This Galea aponeurotica or aponeurosis, it is nothing but a soft layer, soft tissue, soft fibrous tissue, and it extends in front. It extends downwards, and it merges with the subcutaneous tissue of the nose, and this Galea aponeurotica, it extends backwards beneath the occipital bellies, and it is attached to the highest nuchal lines. So on either side it is attached to the zygomatic arch. That is the extension of the Galea aponeurotica. So the Galea aponeurotica, it connects the frontal bellies to the occipital bellies. It is a soft fibrous tissue. It extends below, it extends in front, and merges with the subcutaneous tissue of the face, and it extends backwards behind the frontal bellies, and it is attached to the highest nuchal lines. On either side it is attached to the zygomatic arch. So, and sometimes the Galea aponeurotica, it is thickened and gives origin to auriculus anterior and auriculus superior muscles, or also temporoparietalis muscles. So that's about the Galea aponeurotica. And one more thing is the occipital muscles. The occipital muscles here, the occipital bellies, they are supplied by the posterior auricular branch of facial nerve, and the frontal bellies, they are supplied by the temporal branch of facial nerve. So in the third layer we have muscles, epicranial muscles, and also aponeurosis. And these epicranial muscles, they are nothing but the pair of frontal bellies and pair of occipital bellies, and they are attached by aponeurosis, nothing but Galea aponeurotica. So, and coming to the fourth layer, it consists of loose areolar tissue, loose subaponeurotic layer. It consists of loose areolar tissue, and the emissary veins are present in this area. In the fourth layer, emissary veins are present. We know that emissary veins, they connect the extracranial veins to the intracranial dural venous sinuses. Extracranial veins means the veins present on the scalp. So the emissary veins, they connect the veins present of the scalp to intracranial dural venous sinuses. So the intracranial, we know that we have so many intracranial dural venous sinuses. Out of this, cavernous sinus is very prominent. So this fourth layer consists of potential space. So any infection occurs in the fourth layer, it is very harmful because of the presence of emissary veins. They cause the infection. It enters into the dural venous sinuses, and it is very fatal. And because emissary veins, they connect the extracranial veins to intracranial dural venous sinuses. So any infection present and the sub potential space in the fourth layer, any infection occurs, they immediately reach the intracranial dural venous sinuses. So the fourth layer of scalp is called dangerous area of scalp. The fourth layer is called dangerous area of scalp because of its potential space, and emissary veins are present in this. So, and coming to the fifth layer of scalp, it is called pericranium, and it is nothing but the outer periosteum of the skull, and it is a loose tissue which covers the skull or the bone, and it is near the sutures. We have coronal suture is there, parietal suture is there. Near the sutures, this pericranium, it continues with the endosteal layer of dura mater. So if any swelling occurs in the below the pericranium, like cephalohydrocele, we know that cephalohydrocele is very prominent. That means the fluid, it enters below the pericranium and it assumes the shape of the bones. So that's about the pericranium. And so the skull basically consists of 5 layers as skin. It consists of numerous sweat glands, sebaceous glands and hair follicles are there. And the second layer is dense closed network of fibrofatty tissue. And this closed network of fibrofatty tissue, it connects the skin to the underlying aponeurosis, and it consists of nerves and blood vessels. Then the second layer we consists of nerves and blood vessels. So these walls of the blood vessels, they are attached to the fibrofatty tissue. So any torn happens in the blood vessels, they are unable to retract, so it causes profuse bleeding, and also inflammation of this area causes much pain because of the annealing reticulum. And coming to the third layer, that is aponeurosis or galeria aponeurotica, it consists of epicranius muscles, that is one pair of frontal belly and one pair of occipital bellies. And these frontal bellies have no bony organ, they are raised from the skin and subcutaneous tissue here. And the occipital bellies, they are raised from the lateral 1/3 of the superior nuchal line and the mastoid process. And the occipital belly, they are supplied by the posterior auricular branch of facial nerve, and the frontal belly, it is separated by the temporal branch of facial nerve. And these frontal belly and occipital belly, they are attached, this frontal belly and occipital belly, they are attached by aponeurosis, nothing but galeria aponeurotica, which extends in front and continues with the subcutaneous tissue of the nose, and behind it extends galeria aponeurotica, behind it extends beneath the occipital bellies, and it is attached to the highest nuchal lines. On either side, it forms a thin membrane and is attached to the zygomatic arch, superficial to the temporal fascia. And coming to the fourth layer, that is a loose subaponeurotic tissue. It is a loose areolar tissue, and it forms a potential space, and it consists of potential space where emissary veins are also present in this layer. Emissary veins, we know that emissary veins which connects the extracranial veins to intracranial dural venous sinuses. So this area is known as the fourth layer is called dangerous layer of the scalp, because any infection occurs through emissary veins, it enters into the dural venous sinuses, and they cause a serious it is very serious, it is very harmful, so it is called as a dangerous area of face. And coming to the pericranium, it is nothing but the outer periosteum of the skull, and it's a loose layer covering the outer covering the bone, and along the sutures, it is continuous with the endosteal layer of dura mater. And any fluid collection in the pericranium, which is called cephalohydrocele, which is very harmful. This cephalohydrocele, which assumes the bones of the shape of the bones. So that's about the layers of the scalp. Coming to the blood supply of scalp. So the scalp, it is supplied by turn nerves. So in front of the auricle, 5 nerves are there. Behind the auricle, 5 nerves are there. So in front of the auricle, we have supratrochlear nerve, supraorbital nerve. Supratrochlear nerve, it is branched from the ophthalmic division of the trigeminal nerve, and supraorbital nerve, it is also a branch from the ophthalmic division of trigeminal nerve. And zygomatic temporal nerve, zygomaticotemporal nerve, it is a branch from the maxillary division of the trigeminal nerve, because we know that trigeminal nerve is the fifth cranial nerve. It divides into 3 divisions. One is ophthalmic, maxillary and mandibular. So the supraorbital and supratrochlear nerves, they are from the ophthalmic division of trigeminal nerve, and zygomaticotemporal nerve, it is by the maxillary division of temporal nerve, and next one is temporal branch of facial nerve, and auriculotemporal nerve, it is from the mandibular division of trigeminal nerve. So totally 10 nerves supply the scalp. In front of the auricle, 5 nerves are there, and behind the auricle, 5 nerves are there. So in front of the auricle, we have a supraorbital, supratrochlear, zygomaticotemporal, temporal branch of facial nerve, which supplies the frontalis muscle, and also this auriculotemporal nerve. And coming to the nerves behind the auricle, there are 5 nerves which supplies the scalp behind the auricle. That is the first one is posterior branch of great auricular nerve. Posterior branch of great auricular nerve, it is root value C3, posterior auricular branch of great auricular nerve. And next one is posterior auricular branch of facial nerve, which supplies the posterior auricular branch of facial nerve, supplies the occipital belly and also lesser occipital nerve. And root value is cervical C2, and the greater occipital nerve, dorsal ramus C2, and third occipital nerve, that is dorsal ramus C3. And here we are seeing the diagram of the typical spinal nerve, and here is the section of the spinal cord. Here this is the dorsal root and this is the ventral root. And here the dorsal root consists one ganglion. This is dorsal root ganglion. It consists of pseudo unipolar cells, and these dorsal root and ventral root, this is the dorsal root and this is the ventral root. This dorsal root and ventral root, they unite to form the trunk of spinal nerve. And from the trunk of spinal nerve, we have, this is the trunk of spinal nerve. Again the trunk of spinal nerve divides into dorsal ramus and ventral ramus. And the dorsal ramus, that does not form plexuses at all. The dorsal ramus, they does not form plexuses. Only ventral ramus, they form plexuses. The dorsal ramus does not form plexuses. And this is the ventral ramus. And this ventral ramus, it gives lateral cutaneous branch and anterior cutaneous branch. So the ventral ramus gives a lateral cutaneous branch and anterior cutaneous branch. Only this ventral ramus forms plexuses. So coming to again going to the nerve supply of scalp. So nerve supply behind the auricle, we have 5 nerves. That is third occipital nerve. It is third occipital nerve derived from the C3 dorsal ramus, and greater occipital nerve derived from the C2 ventral ramus, C2 dorsal ramus. And next one is lesser occipital nerve, that is derived from the C2 cervical plexus, and posterior auricular branch of facial nerve, which supplies the occipital belly, and also the posterior branch of great auricular nerve, root value C2, C3. This is about the nerve supply of the scalp. Coming to the blood supply of the scalp, it is by the 5 arteries. One is supratrochlear artery and supraorbital artery, and next one is superficial temporal and posterior auricular artery and occipital arteries. In front of the auricle, 3 arteries are there. So supratrochlear artery, which is a branch of ophthalmic artery, which is in turn is a branch of internal carotid artery, and supraorbital artery, it is also a branch of ophthalmic artery, which is in turn is a branch of external carotid artery, and superficial temporal artery, it is the terminal branch of the external carotid artery. And coming to the posterior auricular artery, it is also a branch from the external carotid artery, and occipital artery is also a branch from the external carotid artery. And that's about the arterial supply of scalp. Veins of the scalp drains into the superficial temporal and maxillary veins, and further they drains into retromandibular vein. The retromandibular vein again divides into anterior division and posterior division. Anterior division combines with the facial vein to form the common facial vein, which drains into the internal jugular vein, and the posterior division of the retromandibular vein, it combines with the posterior auricular vein, and it drains and forms the external jugular vein, which in turn drains into subclavian vein. So that's about the venous drainage of the scalp, and so that is about scalp. So coming to the muscles of facial expressions, we have numerous muscles are there on the face. They are subcutaneous in origin, and all the facial muscles, they are derived from the second pharyngeal arch. So all the facial muscles except masseter, they are supplied by the facial nerve. And of all these muscles, numerous muscles are there. We have frontalis muscle is here, and zygomaticus minor is here, zygomaticus major is here, and procerus is here, corrugator supercilla is here, and one important muscle is orbicularis oculi, orbicularis oris, and depressor anguli inferioris, depressor labiae inferioris, and rhizoras muscle is there, buccinator is there, and we have levator labiae superioris, aliquae nasal, nasalis, all there are numerous facial muscles are there. Out of this buccinator, it is very important, and the buccinator, it is arises from the alveolar process of maxilla and the outer surface of the lateral surface of the mandible opposite the third molar tooth. So the buccinator, it is arises from the alveolar process of the maxilla and also from the lateral surface of the mandible opposite the 3 molar tooth, and also it arises from the pterygoid hamulus. It is a pterygomandibular raphe, and with this pterygomandibular raphe separates the superior constrictor muscle from the buccinator, and it is also a fibrous band which extends from the pterygoid hamulus to the maxillary tuberosity. So the buccinator, it is very important, and the buccinator arises from the alveolar process of maxilla and also the mandible opposite the 3 molar tooth, and also pterygomandibular raphe which separates the buccinator from the superior constrictor muscle, and also pterygoid hamulus, fibrous band which extends from the pterygoid hamulus. It is nothing but fibrous band which extends from the pterygoid hamulus to the maxillary tuberosity. And coming to the insertion of the buccinator, the fibers of the buccinator, they divide into 3 sets: upper, lower, and intermediate. Upper, intermediate, and lower sets. Upper sets, they go straight to the upper lip, and the lower set, they go straight to the lower lip. And coming to the intermediate fibers, they undergo chiasmatic decussation. Coming to the insertion, the buccinator fibers, they are into upper, intermediate, and lower. Upper fibers, they are attached to the upper lip, and lower fibers, they attach it to the lower lip. And intermediate fibers, they undergo chiasmatic decussation at the modulus. Modulus, you can see in the vestibule of the mouth, we can feel the modulus here, and they undergo chiasmatic decussation, and the lower fibers, they are attached to the upper lip, and the upper fibers of the intermediate fibers, they are attached to the lower lip. And the buccinator, it is covered by a fascia that is called buccopharyngeal fascia, and it is separated from the ramus of the mandible and masseter by buccal pad of fat. So, and the buccinator, it is pierced by parotid duct and buccal nerve, which is a branch of mandibular nerve, on the 4 to 5 mucus glands. So the structures pierced in the buccinator is very important. That is parotid duct. Before opening into the opposite the crown of the second molar tooth, the parotid duct pierces the buccopharyngeal fascia and the buccinator, and finally it opens into the vestibule of the mouth opposite the crown of second molar tooth. And the buccinator, apart from the parotid duct, it is also pierced by the buccal nerve, which is a branch of the anterior division of the mandibular nerve, and also it is pierced by 4 to 5 mucus glands. And the action of the buccinator is during mastication, it prevents the food accumulation in the vestibule of the mouth. So the vestibule of the mouth, so this is the vestibule of the mouth. So it prevents the food accumulation in the vestibule of the mouth. And next thing is, it blows the air forcibly, so between the lips. So we can blow the air forcibly between the lips by the action of the buccinator only. So that's about the buccinator muscle. And coming to the nerve supply of face. Coming to nerve supply of face, the face, each half of the face, it is supplied by 30 nerves. Out of these 30 nerves, only one is motor, that is facial nerve, and the remaining 12 are sensory nerves. Out of these 12 sensory nerves, 11 are from the branches of trigeminal nerve, and only one is great auricular nerve, which is derived from C2 C3 cervical plexus. The great auricular nerve, it supplies the skin over the angle of the mandible, and the remaining sensory supply of the face, entire sensory supply of the face, it is derived from the branches of the trigeminal nerve, and the muscles of the face, they are supplied by the facial nerve, because the muscles of the face, they are muscles of facial expressions, they are derived from the second arch. The nerve of second arch is facial nerve, except masseter. Masseter is supplied by the masseteric nerve, which is a branch of the anterior division of the mandibular nerve. The masseter, because the masseter, it develops from the first arch, and the remaining all the facial muscles, all the muscles of facial expression, they are derived from the second arch. So out of these 13 nerve supplies the each half of the face. Out of this, only one is motor, that is derived from the facial nerve, which is the 7th cranial nerve, and the remaining 12 are sensory nerves. Out of these 12 sensory nerves, only one is from great auricular nerve, which supplies the skin over the angle of the mandible, and the remaining all the sensory supply is of the face is derived from the branches of trigeminal nerve. Coming to the motor nerve supply of the face, the motor nerve of supply of the face is derived from the facial nerve. So the facial nerve, after entering into the posteromedial surface of the parotid gland, it gives 5 terminal branches. Okay, so the first 5 terminal branches, the first one is temporal, and the second one is zygomatic, and the third one is buccal, fourth one is marginal mandibular, and fifth one is cervical. So the temporal branch of facial nerve, it goes upwards, forwards in front of the auricle, and it supplies the corresponding muscles here, that is frontalis muscle here, corrugator supercilii is here, and upper part of orbicularis oculi, because the eye is surrounded by orbicularis oculi, and also it supplies upper part of orbicularis oculi, and also procerus muscle is here. So the temporal branch of facial nerve, it supplies the frontalis muscle and the corrugator supercilii and the procerus muscle, and also the upper part of orbicularis oculi. And coming to the zygomatic branch of facial nerve, it runs along the zygomatic arch, and it supplies the lower part of orbicularis oculi. And coming to the buccal branch, the third branch is buccal branch of facial nerve. The buccal branch of facial nerve, it divides into superficial and deep. The superficial branch of facial nerve, buccal branch of facial nerve, it supplies the procerus, and the deep branch again divides into upper buccal and lower buccal. Coming to the upper buccal branch of the facial nerve, it supplies the levator labial superioris muscle, levator labial superioris aliquae nasi, and the nasalis muscle is here, and also it supplies zygomaticus major and minor muscles here, and zygomaticus major and minor muscles, they are help while laughing. Zygomaticus major plays a very important role while laughing, and so the upper buccal, it supplies the levator labial superioris, levatus labial superioris aliquae nasi, and the nasalis muscle is here as zygomaticus major and zygomaticus minor. Coming to the lower buccal, it supplies the orbicularis oris and buccinator. Lower buccal nerve, it supplies the orbicularis oris and buccinator. And coming to the marginal mandibular branch, it runs superficial to the facial artery, and it supplies the depressor angulae oris, depressor labii inferioris, and here is the rhizoris muscle is here, and supplies the mentalis muscle. It supplies all the above muscles. And coming to the cervical branch of facial nerve supplies the platysma. So the motor nerve supply of the face, it is derived from 5 nerves: temporal, zygomatic, buccal, marginal mandibular, and cervical. Temporal branch supplies the corresponding muscles over there. It goes upwards, forwards, and it supplies the frontalis muscle and this corrugator supercilii muscle and orbicularis oculi, and the zygomatic branch, it supplies the lower part of orbicularis oculi, and the buccal branch of facial nerve, it divides into superficial and deep, and the superficial branch supplies the procerus. Deep branches again divides into upper buccal and lower buccal. In between the upper buccal and lower buccal, we have parotid duct intervening. Upper buccal supplies the levator labial superioris, aliquae nasi, and nasalis muscle, zygomaticus major, zygomaticus minor, and lower buccal supplies the buccinator and orbicularis oris, and the marginal mandibular branch, first it appears in the neck region, and finally it runs superficial to the facial artery, and it supplies the depressor angulae oris, depressor labii inferioris, and mentalis muscle, and cervical branch, it supplies the platysma, which is a subcutaneous muscle. So that is about the motor nerve supply of the face. Coming to the sensory nerve supply of the face, it is derived from most of the sensory nerve supply of the face, it is derived from the branches of the trigeminal nerve. We know that trigeminal nerve undergoes 3 divisions. It consists of 3 divisions. One is ophthalmic, second one is maxillary, third one is mandibular. Right. So these three divisions, they supply the face, except the skin over the angle of the mandible. Here is the angle of the mandible is here. The skin over the angle of the mandible, it is supplied by the great auricular nerve. The skin over the angle of the mandible, it is supplied by the great auricular nerve. Remaining all branches are derived from the branches of the trigeminal nerve. Coming to the ophthalmic division of trigeminal nerve, it gives 5 branches. So it gives 5 branches. So here is the first one is the lacrimal nerve. It supplies the skin over the lateral part of the eyelid, and the next one is the supratrochlear nerve. Sorry. So next one is the supraorbital nerve. And this is the supratrochlear nerve. So the ophthalmic division of the trigeminal nerve, it gives 5 branches on the face, 5 sensory branches on the face. This is lacrimal nerve, supraorbital nerve, supratrochlear nerve, infratrochlear nerve, and external nasal. These branches, lacrimal, supraorbital, supratrochlear. Here is the supratrochlear nerve, which is medial to the supraorbital nerve, and the infratrochlear nerve and external nasal nerve. These 5 branches from the ophthalmic division of trigeminal nerve. Okay, the lacrimal nerve, it supplies the lateral part of the eyelid, the skin over the lateral part of the eyelid, and the supraorbital nerve, it supplies the skin and forehead, on forehead up to the vertex. And coming to the supratrochlear nerve, it supplies the medial part of the forehead, and infratrochlear nerve, it supplies the medial part of the eye. And external nasal nerve, it supplies the lateral part of the nose, here, lateral part of the nose. Okay, external nasal, and also it also supplies the aloe of the nose, external nasal nerve. So these are the 5 branches of the ophthalmic division of trigeminal nerve. And coming to the maxillary division of trigeminal nerve gives 3 branches, 3 sensory branches of the face. So first one is infraorbital nerve, zygomaticofacial nerve, and zygomaticotemporal nerve. So the infraorbital nerve, it forms infraorbital plexus on the face, which is a very prominent plexus, because this infraorbital plexus, they communicate with the branches of the facial nerve, and they form plexuses over the lower part of the face, over the lower part of the eyelid. Infraorbital nerve, it is very, very important. And infraorbital nerve, it is a branch from the maxillary division of the trigeminal nerve. And coming to the zygomaticofacial nerve, it supplies the area over the zygomatic arch. We can palpate the zygomatic arch here, and the zygomaticofacial nerve, it supplies the area. So this is the zygomatic arch. So the zygomaticofacial nerve, it supplies the skin over the zygomatic arch, and zygomaticotemporal nerve, it supplies the temporal region at the level of eyelid. So this area, it is supplied by the zygomaticotemporal nerve. So you can see the 3 branches from the maxillary division of trigeminal nerve. This is from the maxillary division, infraorbital nerve, and zygomaticofacial nerve. This is from the maxillary division, and zygomaticotemporal nerve, it is also from the maxillary division of the trigeminal nerve. Oh, okay. Then next, coming to the mandibular division of the trigeminal nerve, it also gives 3 branches. It also gives 3 branches on the face. So the mandibular nerve, it gives 3 branches on the face. The first one is auriculotemporal nerve. So here is the auriculotemporal nerve. Here is the auriculotemporal nerve. The auriculotemporal nerve, it emerges from the apex of the parotid gland. Okay, it supplies the temporal region. It supplies the temporal region, and this is about the auriculotemporal, the skin over the temple. It supplies the skin over the temple. This is the auriculotemporal nerve, which is derived from the, auriculotemporal nerve. Here is the auriculotemporal nerve. It derived from the mandibular division. It is from the mandibular division of trigeminal nerve. Usually auriculotemporal nerve, it divides into auricular branch and temporal branch. Auricular branch supplies the skin over the external acoustic meatus and adjacent membrane, and also it supplies the ear pinna. And temporal branch, it supplies the temple region. temple of the face. It supplies the temple of the face. And this auriculotemporal nerve, it is derived from the mandibular division of trigeminal nerve. And coming to the buccal nerve, it supplies the lower part of the jaw. It supplies here the skin over the mandible, the skin over the near the lower jaw. And coming to the buccal nerve, auriculotemporal, and coming to the mental nerve, it supplies the lower lip, and also the buccal nerve, it supplies the mucous membrane of the vestibule of the mouth. And mental nerve, it supplies the skin over the mental region, over here lower lip, and also the vestibule. It also supplies the vestibule of the mouth. So auriculotemporal nerve and buccal nerve is also it is also a branch from mandibular division of trigeminal. And also mental nerve, it is also a branch from mandibular division of trigeminal nerve. So that's all about the sensory nerve supply of the face. So sensory nerve supply of the face, it is 12 nerves. They supply each half of the face. So out of these 12 nerves, major 11 nerves are derived from the branches of trigeminal nerve, and only the skin over the angle of the mandible, it is supplied by the great auricular nerve, C2, C3, cervical plexus. So coming to the trigeminal nerve sensory supply, trigeminal nerve, it consists of 3 divisions: ophthalmic, maxillary and mandibular. From the ophthalmic division, 5 branches supply the face, and from the maxillary division, 3 branches supply the face, and from the mandibular division, 3 branches supply the face. So from the ophthalmic division, we have lacrimal nerve, supraorbital nerve, supratrochlear nerve, infratrochlear and external nasal. And from the maxillary, infraorbital nerve, which forms infraorbital plexus with the branches of facial nerve, which is very prominent plexus, and zygomaticofacial nerve, and also zygomaticotemporal nerve. And from the mandibular, 3 nerves supplies the face, that is auriculotemporal nerve, buccal nerve and mental nerve. So that about the sensory nerve supply of the face. Okay. And one more thing is here, the face, it is derived from 3 processes: frontonasal process, maxillary process and mandibular process. The part of the face which is derived from the frontonasal process, that means the eyes, the forehead and the nose. The part of the face which is derived from the frontonasal process, it is supplied by the ophthalmic division of trigeminal nerve. The part of the face which is derived from the maxillary process, because we know that maxillary process, they form the upper cheeks and the lip, right, upper lip. So the part of the face which is derived from the maxillary process, they are supplied by the maxillary division of trigeminal nerve, and the part of the face which is derived from the mandibular processes, which is supplied by the mandibular division of the trigeminal nerve. So that's all about the sensory nerve supply of the face. And coming to the arterial supply of face, so coming to the blood supply of the face, the blood of the arterial supply of the face, it is derived from the facial artery, which is a branch of the external carotid artery. The facial artery arises from the external carotid artery just above the tip of the greater corner of the hand bone. And the facial artery enters on the face by at the antero-inferior angle of the masseter by winding round the angle of the mandible at the antero-inferior angle of the masseter, by winding round the lower border of mandible at the antero-inferior angle of the masseter. The facial artery enters the face, and this facial artery, it is crossed superficially by the marginal mandibular branch of facial nerve, and the facial artery, it ascends upwards and medial up to the medial angle of the eye, where it anastomoses with the dorsal nasal branch of ophthalmic artery. The dorsal nasal branch of ophthalmic artery, which is intern, is a branch of internal carotid artery. So the facial nerve, the facial artery arises from the external carotid artery just above the tip of the greater corner of the hand bone, and it enters the face by winding round the lower border of mandible at the antero-inferior angle of the masseter, and it ascends upwards up to the medial angle of the eye, where it is anastomoses with the dorsal nasal branch of ophthalmic artery. Coming to the branches of the facial artery, the facial artery here gives 3 branches: inferior labial, superior labial and lateral nasal. Inferior labial supplies the lower lip, superior labial supplies the upper lip, and lateral nasal supplies the nose. And also apart from the facial artery, one small artery also supplies the face, that is transverse facial artery. So this is the transverse facial artery. So this is the transverse facial artery, which is a branch from superficial temporal artery, transverse facial artery. So the arterial supply of the face, it is derived from the facial artery, mainly by the facial artery and also transverse facial artery. And the facial artery is tortuous in nature, because we have to move the mandible, we have to speak, everything like that. So the facial artery is tortuous in nature. So apart from the facial artery, transverse facial artery also supplies the face. Okay, and this facial artery, it is overlapped by zygomaticus major, minor muscles, and it lies on the mandible, and it lies on the buccinator muscle, and it reaches the medial angle of the eye. And coming to the venous drainage of the face, is derived by the superficial veins and maxillary vein, the superficial temporal vein and maxillary vein. They unite to form the retromandibular vein, divides into anterior division and posterior division. Anterior division combines with the facial vein. Here is the facial vein is there to form the common facial vein, and the posterior division, posterior division of the retromandibular vein joins with the posterior auricular vein, with intern drains into external jugular vein, and finally into subclavian vein. So that's about the venous drainage. And one more important thing is, this facial vein is devoid of valves, and the facial vein, it communicates with the cavernous sinus here. The facial vein communicates with the cavernous sinus here through deep facial vein and also superior ophthalmic vein. The facial vein communicates with the cavernous sinus through deep facial vein and also superior ophthalmic vein. So, and the facial vein is devoid of valve, so the area, the lower part of the nose and upper part of the lip, this area is called dangerous area of face, because the facial vein is devoid of valves, because as if any infection occur in this area, because of the facial vein is devoid of valves, the infection goes in the retrograde direction. And it affects the cavernous sinus. That is a serious complication. That is a serious implication. So the lower part of the nose and upper lip, they are considered as the dangerous area of face, and any infection occurs is very dangerous, because the infection may pass through the cavernous sinus, because as the facial vein is devoid of valves, and also because of the movement of the muscles, the infection pass in the retrograde direction. So that's about the venous drainage of the face. So that's about the blood supply of the face.